CoIIN has really asked public health departments to do something to improve birth outcomes, recognizing that they can't do it themselves, and that part of the requirement is collaboration.
I like the fact that with CoIIN they always say still shamelessly. So it's like in this CoIIN process, you hear so much about what other states are doing. You can like take a piece of this, take a piece of that, and then you can create something yourself.
It's been great to just be able to have connections with states and use the tools that they've used and use what's worked for them and adapt it for our state.
It has energized us. I would say we've had an opportunity to reach out to partners that are not traditional for maternal-child health. We've needed partners who work in the field of incarceration or with tax policy and housing. So it really has sort of been a catalyst for us to reach out to them in an intentional way to get their expertise.
It's a social network. It literally is a social network with social capital and people power.
The MCH field has known forever that poverty and other issues like that, racism, poverty, housing quality, are tremendously important in infant mortality. But we haven't had any ideas of how to do something about it. The CoIIN, I love that it is trying to get us to think outside the box, to try to think about new partners, new ways of doing things.
We're sharing ideas. Now we're sharing innovation models. We're looking at what their states are doing as far as pilot sites, and we're thinking about and implementing the same thing. So this has been bigger than it was before.
It's sort of like shaking us all up and saying, look at it differently. Don't put on a different set of glasses and see what you can do to change the outcome.
CoIIN is creating an environment where it encourages innovation. It encourages us for testing small scale and large scale environments, the new approaches to doing things.
There's no stupid ideas. People can throw anything out there. It may work, it may not work, but if you don't share it and you don't try, you won't know.
In the QI methodology, we're reducing variance. We're sharing the best practices, and we're reducing the variance. We're eliminating some of the lesser activities that aren't working and building up a knowledge base, a collaborative knowledge base of what works the best.
That's where QI comes in, because what it says is instead of trying to cover up your weaknesses and submit the most pretty report you can, let's look for your weaknesses and wow, that's an opportunity to do better. It's not a bad mark, it's an opportunity to get something better for the clients you work with.
It's really a culture change to collect data and to study what you do and to use what you get back to make improvements in a short period of time. And so that is a philosophy we're trying to apply to everything that we do now, and to make sure that we're planning our objectives, using data again to monitor how we're doing and to make adjustments to what we're doing in a timely fashion.
Quite often you're busy trying to implement that you don't circle back and look to see, okay, let's look at our process. Let's look at whether or not we're making an impact. What's the quality of the services that we're providing? Is it making a difference? So I think CoIIN, it gives us some of the tools that allows us to start thinking in that direction.
It's okay to miss the mark as long as you're reflecting and taking lessons learned and applying it to a new situation.